Infertility. Today we're going to be discussing what the definition of infertility is. Second, we're going to be discussing how infertility impacts both men and women. What is infertility? Infertility occurs when a couple, which is a male and a female, are unable to conceive a child. This can also mean a female is able to get pregnant but unable to stay pregnant for multiple reasons. Most couples, or about 85%, will become pregnant in the first 12 months of trying to have a child. Afterwards, another 7% of couples will become pregnant during the second year. For women 35 years or older, infertility is considered going 6 months or longer without being able to conceive a child. How common is infertility? According to the Centers for Disease Control, the CDC, about 1 in 10 women, or 6.1 million, between the ages of 15 to 44 in the United States will have difficulty becoming pregnant or staying pregnant. What causes infertility in women? Most cases of female infertility are caused by problems with ovulation. This is the releasing of the egg. Females also may have blocked fallopian tubes due to issues such as endometriosis. And finally, there can also be physical problems with the uterus. What causes infertility in men? Erectile dysfunction, which is the inability to keep an erection. This makes it difficult to release male sperm into the female's vagina. Additionally, a low number of healthy sperm or no sperm at all can also be a primary contributing factor. And third, the movement of the sperm, meaning that the sperm have difficulty getting to the female's egg in through the vagina. Factors that increase infertility. For women, primary contributing factors include age, being 35 years or older, smoking, excess alcohol use, stress, poor diet, athletic training, being overweight or underweight, and finally also having sexually transmitted infections, otherwise known as STIs. For men, infertility can include the use of drugs, alcohol, and tobacco, emotional stress, and finally a large contributing factor can be being overweight. Older women, trouble getting pregnant. About 20% of women in the United States have their first child after the age of 35. Age is a growing cause of infertility. Related reproductive issues. A female with ovaries that become less as she becomes older. She will have a smaller number of eggs available to release. Her eggs are not as healthy as she gets older. She will be more likely to have health conditions that can cause infertility problems. And finally, she is more likely to have a miscarriage as she increases in age. Altogether, these are all issues with infertility in both men and women.